Hysteroscopy is many times needed in an IVF cycle. So what happens? It is the endometrial cavity that we see when we do a hysteroscopic examination. It is done in general anesthesia and it takes very less time, hardly 5 to 10 minutes. It can be of two types, diagnostic or operative. In the diagnostic process, we try to see what is the problem in the uterine cavity, because many times what happens when we do a 3D, 4D examination, the uterine examination by TVS, all the reports come normal, but the patient still has unexplained failures. So we put the scope, we see inside the cavity. Many times there is a septum present inside, many times there is a small polyp. We take that biopsy or we send the sample for tubercular studies. Many times we do a uterine PRP also, hysteroscopic guided, just to increase the success rate of implantation. So these are some of the times and some of the indications why we do a hysteroscopy in patient, just to increase the success rate, because the patient is not able to understand that there is no problem in the uterine cavity, but still the doctor is telling them to do a hysteroscopy. The ultrasound report is totally normal. Fourthly, there are patients in which the uterine cavity is small and it doesn't increase by medicines. So in these patients also we cut the uterine cavity and we grow the uterine cavity in shape by doing metroplasty, so that after that the success rate for the pregnancy implantation increases. So these are some of the indications why we do a hysteroscopy. For fibroid also, many times when the fibroid is more in the uterine cavity and there are clauses for that also, that can also be removed hysteroscopy. But in all cases, fibroid can't be removed hysteroscopically. So these are some of the indications for doing hysteroscopy. It is a totally daycare procedure and you can go back to office, you can resume your work next day. So there is nothing to be anxious about it, nothing to be afraid about it. You should go ahead with the process and you should get it done to achieve more implantation and more success rate. We care about you.